Hi there. Thank you for joining me on the program, Your Doctor and COVID. I'm Dr. Mahendra Carpen. I'm the Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. We are continuing our discussions around the COVID-19 pandemic. And remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. We continue the discussion around the COVID-19 pandemic, and today we have with us in studio as we're recording here Dr. Camila Bimal Suku, a specialist in the field of hematology working at the Georgetown Public Hospital Corporation. And I'd like to take this opportunity to welcome Dr. Bimal to our program and hope that she has a lot of information to share with us today. So welcome, Dr. Bimal.
Thank you, Dr. Carpen.
So you are a hematologist. You have been trained in Canada and you have rejoined us in Guyana at the Georgetown Public Hospital about 2 years now. Is that correct?
Yes, I've completed my studies 2 years ago. This July it's going to be 2 years.
Okay, great. So you and I are at least 6 feet away from each other, and it is, it's quite fine if you were to take the mask off.
Yes, that would be great.
So for the rest of our conversation, we can take it off.
Yep,
so
thank you.
You can be a little bit more comfortable and you can speak clearer.
Yep.
So tell us, for our viewers and listeners, what is hematology and what is the field of hematology?
So hematology has to do with any kind of disorders that involve the cells of the body.
Yeah.
As you know, the bone marrow is the factory of your body, and it produces red blood cells, white blood cells, platelets. These are the major cells in your body, and anything that involves those cells has to do with hematology. Also, hematology looks at any kind of bleeding disorders. So, for example, a common thing that people probably would have heard this morning, I was speaking on the radio about, would be hemophilia. But there are other bleeding disorders that, it's not really popular, that we don't know about.
Right.
So that's the next thing I look at. And then one big area would be blood clots.
Okay.
So you can have blood clots almost any part of the body, and that's one of the things that I will look at as well. So in a nutshell, it's anything that has to do with the cells of your body. So red blood cells, white blood cells, platelets, any bleeding disorders, clots, any inherited conditions such as sickle cell disease, thalassemia, hemophilia.
Right. So in a nutshell, to make it simple for our audience, diseases of the blood that involve any of the cell lines that are produced and are part of the blood.
Yeah.
So can you tell us what the specific, simple roles for the red blood cell, the white blood cell, and the platelets?
Mm-hmm. So the red blood cell, the main function of the red blood cell is to carry oxygen around the body.
Right.
So if you don't have enough red blood cell, then you don't have enough cells to take oxygen around the body, and you can have difficulty breathing.
Okay.
So that's the major function. The white blood cell fights off infection. If the white blood cells are if it's not in the correct amount, if it's less than it should be, then you will be at risk of having maybe a full-blown infection. Whereas if it's in the correct amount, it can take care of an infection. And then you have conditions such as cancers and all of that where the white blood cells are really high. Right. The other thing is the platelets, and these are important to help with clotting. So right. Once you get a bleed, platelets are one of the first cells that will go there to form a blood clot to stop the bleeding.
Stop bleeding.
Yeah.
And that's a normal reaction, right?
That's your normal physiological makeup.
Right. And then, of course, there are times and conditions where normal reactions are exaggerated, and
yes.
then that becomes a problem.
Yes, definitely.
So why did you choose the field of hematology? And I am, quite free to share that we don't have, or we haven't really had a rich history of hematologists in Guyana, even though we have had significant number of patients who have diseases of the blood, for example?
Yeah. So I've graduated since 2003.
Okay.
And since I've been working at the hospital, it has been quite challenging to see the pains and suffering that hematology patients will go through. And you know, we have no specialty to deal with it. It's so heartbreaking. And especially in pediatrics, right? You know, kids, you know, they always get the softer side of you. So when I was asked what I wanted to do for my fellowship training, that's one of the things I wanted to do, to go into hematology and you know, try to help persons as much as possible when I return. Yeah.
So you mentioned fellowship. Can you tell our audience, our viewers and listeners, what do you mean by fellowship? I mean, you have to go to medical school to become a doctor, but what is fellowship really?
Yeah, so you go to medical school, you graduate, and then you become an intern. You become a general medical practitioner, and then you work for a period of 1 to 2 years. Then you will go into a residency program. So I actually did a residency program here, which was 3 years. Now it's about 4 years. So I was actually the first batch of internal medicine and infectious disease specialists, that batch of residency. And then after that 3 years, then you even further specialize in something else. And that's the fellowship. So it's a postgraduate kind of training. And it can be 1 to 2 years. So I did my fellowship in 1 year. And you usually do it out of Guyana, right?
At the moment.
At the moment, yeah. So fellowship is something fairly new to Guyana. So of course, at the moment, it's out of Guyana. So I went to Canada, where I had a 1-year training at the McMaster University in Canada. So during the fellowship, of course, you're there for the year, missing home so much. But I mean, it's a sacrifice, right? It's a sacrifice you have to make. And then while you're there, you're working at various hospitals as a doctor, seeing patients, mixing with patients, doing everything you usually do back home, right? As a practicing doctor there. So for me, I rotated it amongst 4 of the top hospitals there, where they have a variety of hematological cases that I would have had a chance to look at and train in.
So your fellowship you spend in that specific area that you are specializing in.
Yes, definitely.
Lots of volume, lots of exposure, lots of in-depth type of training to deal with these types of patients.
Yes, definitely. It's all hematology. It's nothing really mixed with hematology.
Correct. Okay, so you mentioned earlier that platelets are involved in forming blood clots. And as you know, around the world right now, there is some concern or some chatter about blood clots as it relates to vaccines being given for COVID-19. We are in the COVID-19 pandemic, and I wanted to hear your thoughts, your opinions. First, what are blood clots? And what are your opinions about blood clots and the link between vaccines?
So a blood clot is, it's a simple accumulation of cells where you'll have a mixture of cells, platelets, and other things in the body that will form around that accumulation of cells to try to hold it together. Right. So usually, if you have a normal clot in the body, your body system has certain chemicals that will be attracted towards that clot and it will break it down, right? Okay. So a blood clot is an accumulation of cells, and around that now has like a protective layer to hold that clot together, right? So usually in a healthy person, they can have small blood clots that, for example, if you got a trauma to the hand or anywhere in the body.
Like if I cut myself shaving.
Or if you cut yourself shaving, right, you'll have a small clot forming there. And in a normal healthy person with no disorders, no hematological disorders, the body system will break down that clot.
Right.
But in persons who have hematological disorders or infections or other kind of illnesses, their body might not be equipped to handle a normal blood clot.
Okay.
And that clot can actually get bigger, or you can have clots forming in other parts of the body all at the same time, and then it can become a problem. In terms of the vaccine, there are studies ongoing, as you know, and there seems to be an association with blood clots and the Astrazeneca vaccine.
Okay.
All right? And these blood clots are formed in the uncommon places. So for example, in a person, or the usual blood clots that you will have patients coming into you with will be the vein clots, which is mostly in the legs.
In the legs, right.
Right? But with the Astrazeneca vaccine, the clots that they've been seeing would be clots in the brain and in the vessels of the abdomen,
Okay.
or close to the intestine. So those are the two common sites, and they're unusual sites for blood clots. So there is an association with the Astrazeneca vaccine, but you know,
is it
studies.
a common finding in persons taking the vaccine?
It's not common. It's about 1 in 4 million, something like that.
1 in 4 million.
Yeah.
So in a population like Guyana, where we have less than 1 million people,
Yeah.
would you expect to see a lot of those complications?
Probably not.
Probably
not.
So in fact, in our readings across the Caribbean, our first vaccines across the Caribbean have been AstraZeneca.
Yeah.
And so far, in about over 1 million people in the Caribbean that have been vaccinated, we haven't really had any reports from any of the territories at all that have started vaccinations. Does that surprise you, given what we already know about how rare this side effect is?
It doesn't surprise me, no, of course not, no. And as a matter of fact, if you do think about it, for you, the normal incidence or occurrence of a blood clot is about 1 in 1,000 person. All right?
Wow.
So even without having a vaccine, 1 in 1,000 person is at risk to have a blood clot.
Yeah.
So 1 in 1 million, 1 in 4 million, you know, it's really a large number to say, you know, the vaccine is solely responsible for something like that. And because of that reason, you shouldn't take a vaccine. Because 1 in 1,000 is at risk for a blood clot.
That's even without COVID, without COVID
anything.
vaccines. But it's interesting as well that even having COVID before the development of vaccines, there was noticed an increase in the risk of clots by just having COVID. Do you want to comment on that?
Sure. So usually, a lot of infections can predispose you to blood clots. And COVID so happens to be one of that infection because of, you know, the pathology itself. I'm just trying to use simple terms here. But, you know, the way how COVID acts itself and the cells that it attacks to are cells that are involved and that will upregulate blood clot formation. So how COVID acts is that it uses up all the cells that will stop a blood clot formation.
Okay.
Right? So if clots are formed, then the cells are not there to break it down, and it also increases that cascade to form clots. So it forms clots, and it takes away that protective mechanism to break down clots.
So this is COVID itself.
This is
not
just
COVID vaccine.
No, not COVID vaccine.
Right.
Just COVID itself. So in these patients, because there is an increased risk of formed blood clots, when you're treating them, you actually have to start them on medications to prevent blood clots in them, which is very, very important.
So these are the hospitalized patients who have COVID.
Yes, hospitalized.
You have to put them on blood thinners.
Yeah, that's COVID positive, yes.
Yes.
Yeah.
So we've been talking to Dr. Bimal, who is a specialist in hematology, the area of medicine that deals with blood clots and diseases of the blood, etc. We have heard her opinions. We have heard her expert knowledge on the vaccine as it relates to clots and the risk of blood clots. So just to summarize, do you think that there is sufficient reason to stop vaccines based on blood clots?
Definitely not. Definitely
so you would recommend based on the risk versus benefit, your recommendation would be to
give vaccines or to take your vaccines. As a matter of fact, you contracting COVID will kill you faster than a blood clot will kill you.
Okay, so thank you very much, Dr. Bimal, for sharing your expertise with us. And remember, guys, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275, or you may send an email to docandcovid@gmail.com. Thank you once again for joining us.